horizon for PRK?
Well, actually, PRK is here now. You know, it's a great operation. As we said before, here at the New Jersey Eye Center, we get 98% of our patients achieve 20/20 vision without any need for glasses anymore. That's PRK. The new procedure that's been developed over the last couple of years is called LASIK. That's a little bit more complicated. And the reason it developed was because in some of the earlier models of the laser way back when we first started doing this procedure by Brand X, for example, there were some complications with the laser. And therefore, it was decided that maybe there's a safer way of doing the procedure. Instead of just treating the surface of the eye with the laser beam, how about treating the inside of the cornea, raising a flap and treating the inside of the cornea, then laying the flap back, and maybe we could avoid some of the past complications, which don't occur today anyway. So in the last couple of years, LASIK has been becoming more popular. And I think probably there is a place for LASIK in the future. I think there is. At the present time, it may be the procedure of choice for people who have maybe very high degrees of nearsightedness, only because of the fact that even though PRK works very, very well at any degree of nearsightedness, it takes a little bit longer for the vision to return with PRK. Whereas LASIK, it returns quicker. So today, I think LASIK's position is that it is more adaptable to high degrees of nearsightedness. As time goes by, and we get more experience with LASIK, we may be able to use LASIK for lower degrees of nearsightedness, astigmatism, and farsightedness. I think there's more work that has to be done with LASIK. We need more experience as well.
How would a patient choose between as to what procedure? You offer all of these procedures at the New Jersey Eye Center?
We do. We offer all the procedures, all laser refractive procedures at the New Jersey Eye Center. And of course, our longest background is with PRK. Like with anyone, it's PRK. LASIK is relatively new, and my personal feeling is that at the present time, as of 1998, that LASIK should be reserved for people who have higher degrees of or thicker glasses, for example, so they can get a quicker return of their vision. Whereas the PRK can be used for anyone. So a person comes to me and asks me, what's the best procedure, PRK or LASIK? And I will tell them, based on my experience, okay, and their condition, which is better for them, either PRK or LASIK.
What are some of the dangers of LASIK?
Well, I wouldn't say dangers. You know, PRK is a one-step procedure. It's very simple. It takes maybe 30 to 60 seconds for it to take place. That's it. LASIK is a two-step procedure. It does take longer. It may take 5 minutes to perform, and therefore, 2 steps is more complicated than 1 step. 2 steps requires a lot more experience than 1-step procedure, and there is some possible complication or side effects associated with the flap making, and that's probably the only bugaboo we really have right now, is producing of a safe flap. I think that's all going to be worked out over the next couple of years, and LASIK is going to become a very, very successful and a very safe operation to perform. But right now, as the FDA says, PRK is approved. It's the safest and most effective and most accurate procedure that's being performed to get rid of glasses.
Are there complications? Could there be complications from LASIK?
I would say, yes.
Before you start, the truck that's going. Since it was in the beginning, I figured I might as well hold you up.
Okay.
And as soon as Ray gets in,
Cutting the
Yeah, you stop making all this noise coming downstairs. So anyway,